Alameda County, home to over 1.5 million people living in 14 cities. Rich in arts, culture, community activism, and higher education, Oakland is the largest city and one of the most linguistically and culturally diverse in the country. Yet Alameda County is also a place where the aging housing stock is beset with serious hazards that pose a threat to the health and safety of our most vulnerable populations.
And I kept hearing something scratching on the wall, and he was plucking this paint off the wall, and by the time I got to him, he done been eating some. When he did get sick and I took him to the doctor, that's when they realized that his lead poison was way up high.
Jimena empezó con la tos y se fue como con dolor de pecho y ya era puro llorar y llorar y llorar. Entonces fue cuando la llevamos al hospital. En el hospital la revisaron, la detuvieron y le estuvieron poniendo oxígeno. Le declararon el asma. Estuvo tres semanas y medias en el hospital.
Lead hazards, asthma triggers, pest infestations, and safety issues are just some of the conditions that plague our housing stock and jeopardize the health and well-being of all our residents. But amidst the aging and rundown housing stock, there is a program that stands out.
Our niche is that we assess and analyze the home environment for housing hazards and determine how those hazards impact the lives of the people living in those homes.
The Alameda County Healthy Homes Department started out in 1991 after the community, organized by People United for a Better Oakland, rose up and demanded a solution to the high rates of childhood lead poisoning.
We had to mobilize as far as going door knocking and educating the people, getting them to help support us, to come to hearings, to come to protests.
Out of this organizing was born the Alameda County Lead Poisoning Prevention Program. As the program evolved, it became clear that many homes in Alameda County had multiple health hazards that needed to be addressed: mold, pests, and safety hazards. To reflect the breadth of the program's work, the board made a decision to update the name to the Alameda County Healthy Homes Department.
That name change into Healthy Homes is one of the best things that has ever happened to this organization. It will be a legacy that will be passed on to the next generation, that we have an agency, a county agency, that is here to promote healthy homes, not just one aspect, but the entire home.
Program staff provide a dynamic, combined expertise of public health nurses, community health outreach workers, environmental risk assessors, health educators, construction and remediation project designers, and support staff.
Healthy Homes took care of all the contact work with the landlord next door, and there's been no issues since.
When you look at the Healthy Homes Department, you're actually looking at a organization that is a hybrid of both building inspection services, environmental health services, and public health services.
We work with families in providing them tools, information, so that they can be self-informed on how they can also improve their home environment so that they can improve their health.
What was most interesting, I think, for us that we never even thought about was the other things, like the toys and the sort of consumer goods that contain lead that we never would have thought about.
Poco a poco fui aprendiendo que los polvos, las personas que fumando cerca de mi hija, los olores fuertes, todo eso le causa más peor el asma.
Part of taking care of patients and families is to recognize that I can pick up certain illnesses or conditions in the four walls of my exam room and I can make interventions. But since many of these problems are upstream, it is helpful to have partnership and collaboration to know that I can trust the team to go to the home, to interview the patients, to identify the toxic sources of the toxicities, and to make interventions there and to really stem the issue there. That partnership of in the exam room, out of the exam room, really is the wraparound care that we need for moving the population's health to a better place.
Somos promotoras de salud. Para mí, un promotor es la persona que lleva información a otras familias, que ayuda a otras familias a prepararse, a informarse, ponerse en los pies de la otra persona.
One of the nice parts about doing this is it's ongoing, so we follow up. The Healthy Homes program with the nurse education component, they follow up with the family to make sure that they're reinforcing the training that they're getting.
Fue la mejor ayuda que me pudieron haber dado de hogares sanos para que mi niña estuviera bien, porque sin ellos no hubiera habido algún cambio en cómo viviéramos nosotros.
Right now we're doing much better, you know, in our new place that we're in, and the Healthy Home Department been with us all the way.
The Healthy Homes Department is now one of a few select programs in the United States participating in the Advancing Safe and Healthy Homes initiative, modeling its effective approach on a national level.
It's phenomenal. I've worked in a lot of the places where you have to go outside to obtain that kind of skill set, and we have it here. For example, we have housing folks, we have architects, people with medical background, with housing background, with environmental and contractor background. This expertise is in a place that I can just tap in. Our core competencies are there, and we're only getting better at this.